My name is Richard Penney, Vascular and Interventional Radiology, Essentia Health, Fargo. My mom was an ER nurse. I was kind of raised in the hospital, and I really enjoyed the environment, enjoyed the patients and seeing kind of what they were going through, and thought I could make a difference in that. And so that was kind of the selection process. I was actually introduced to interventional radiology late in my training process and found that I really enjoyed the spectrum and diversity of patients and disease that we saw and treated, and that we could do things that previously required large open surgeries through a simple pinhole or a needle hole, and patients could go home same day and without complications. You see the very, very healthy to the very, very sick. And we get to treat, patients who may have something as simple as just pain to something as complex as dying from bleeding. And in fact, we see patients that come in and are bleeding to death, and we get to send them home that day after a 20-minute procedure. They're unsure about my specialty and what I'm going to offer because they have never heard of it, or it's this new, on the edge kind of thing, and that brings fear with it. And truthfully, I tell you, the vast majority of my patients, I just tell them it's going to be so much less than you have in your mind. That the image that you've built up in this picture is so much worse than anything I'm going to do, that they're going to sail through it, they're going to do great, and they'll not even remember most of what we did. Really enjoy reading. I read a ton. I probably go through a book a week. As well as I ski and snowboard, I wakeboard, I like to water ski. I have 2 little boys and my wife, and I am constantly running people everywhere, and I get a lot of joy out of that.